Today we are diving into a concept that is, and I mean this, absolutely fundamental to all of healthcare. It's called validity. Think of it as the bedrock that makes sure the tools we use in nursing are actually telling us the truth. And really, this is the question we have to ask ourselves, right? Because in a field where decisions can literally mean life or death, how do we know our tools are reliable? Whether it's a pain scale, a fall risk assessment, or even a patient satisfaction survey, we have to be able to trust the data. And that trust, it's all built on a foundation of validity. So here's our game plan. First, we're going to nail down what validity even is. Then we'll walk through 5 key types, and don't worry, we'll use real nursing examples for each one. And finally, we'll tie it all together and talk about why this matters so much for patient care. All right, let's kick things off with the big question. What exactly are we talking about when we say a tool has validity? Okay, in the simplest terms, validity is all about truthfulness. It asks, does your instrument, whether that's a questionnaire, a physical test, whatever, actually measure the one thing you think it's measuring? For example, if you've got a scale designed to measure anxiety, you need to be absolutely sure it's capturing anxiety and not accidentally measuring something else that just looks similar, like general stress or even depression. Now here's a really key point. Validity isn't like a simple on or off switch. It's not a yes or no question. It's much more like a dimmer switch. A tool can have low validity, moderate validity, or high validity. The goal for any researcher is to pile up enough evidence to prove their tool is way up on the high end of that scale. So let's look at our first 2 types. These are all about judging an instrument based on what it contains and, well, how it looks on the surface. With content validity, the magic word is comprehensiveness. It asks, does this tool cover all the necessary bases? You know, if you're creating a test about diabetes management, you can't just ask about diet and call it a day. To have strong content validity, you would need questions on medication, blood sugar monitoring, exercise, foot care, the whole shebang. So, how does this actually play out? Let's say you're building that hepatitis B knowledge questionnaire. You wouldn't just write a few questions and hope for the best. No way. You'd bring in a panel of experts. We're talking infectious disease specialists, public health nurses, and they would comb through it, making sure every critical aspect of the disease is covered. It's their expert stamp of approval that establishes content validity. Next up is face validity, which is, well, it's pretty much exactly what it sounds like. Does the tool, just on the face of it, look like it's measuring the right thing? It's the most basic check you can do, and because it's so subjective, it's definitely considered the weakest form of validity. But hey, it's still a super important initial gut check. Here's a perfect example. A researcher creates a test on tracheostomy care. To check for face validity, they could just ask the nursing students who took it, hey, did that feel like a fair test of your knowledge? If the students all nod and say yes, then boom, the test has face validity. It's based entirely on their personal perception. Okay, now we're going to wade into some deeper, more theoretical waters. How in the world do you measure something you can't see or touch? Things like knowledge or patient satisfaction or grief, that's where construct validity comes into play. This is a huge deal in nursing because so many of the things we care about most are these constructs. They're abstract ideas, not things you can measure with a ruler. Construct validity is the evidence that tells us our tool is truly tapping into that complex, unseen concept we're trying to get a handle on. A really clever way to establish this is with something called the known groups technique. Let's go back to our hepatitis B questionnaire. Logically, we'd expect experienced postgraduate nurses to know more than recent graduates, who should know more than students still in school, right? So, if we give them all the test and their scores line up just like we predicted, low, medium, and high, just like this chart shows, that's powerful evidence that our tool is really measuring the construct of hepatitis B knowledge. All right, next up, criterion-related validity. This one is all about comparison. How well do the results from our new tool stack up against some other external, trusted benchmark, what researchers often call a gold standard? This type of validity actually breaks down into 2 main flavors. Over on the left, you've got predictive validity. This looks to the future. A fall risk scale has great predictive validity if the patients who score high on it actually do fall more often in the months that follow. Then on the right, you have concurrent validity. This is all about the here and now. It checks if your brand new tool for, let's say, self-esteem gives similar results to an existing well-established coping scale when you give them to the same person at the very same time. Our final type of validity is maybe the most practical and action-oriented of the bunch. This one is all about using data to make real improvements. Formative validity is all about getting useful feedback that you can actually act on. So picture this. An assessment tool is given to a group of nurses. The results come back, and they clearly show a specific knowledge gap in infection prevention. So what happens? The hospital uses that very specific data to immediately redesign its training program. The fact that the tool provided the information to drive that tangible improvement, that is what makes it formatively valid. Okay, we've covered a lot of ground. We've gone through a bunch of different types of validity, so let's zoom out and focus on the bottom line. Why should every single nurse actually care about this stuff? This quote really gets to the heart of it. Validity isn't just some boring academic exercise. It's how we make sure our research findings are real and trustworthy. It's the very thing that lets us build upon each other's work and create a solid, reliable body of knowledge for the entire nursing profession. And ultimately, it all comes back to this. Valid tools give us accurate data. Accurate data helps us make better clinical decisions, and better decisions lead to safer, more effective care for our patients. It's what allows us to justify our interventions with hard evidence, and it really elevates nursing as a scientific profession. It is the absolute foundation of evidence-based practice. So I want to leave you with this one question. The next time you pick up a pain scale or a depression screening tool or any assessment in your practice, just take a second and ask yourself, how do I know this is valid? What's the evidence behind this? Because knowing a tool is valid means you can trust the story it's telling you about your patient. Thanks for tuning in.